Ladies and gentlemen, boys and girls, good morning for our viewers across the world. Welcome to another edition of the Excellence and Impact Foundation podcast, where we highlight and engage with change makers across the areas of healthcare, education, entrepreneurship, and leadership. Today, we have the pleasure of speaking with one of our distinguished educational professionals, professor, doctor, you name it, he got it. The man has so many credentials. I'll let him introduce himself because I don't know where to start. All I got to tell you, he is very impressive, very well learned, very well spoken, has a lot of gravitas when it comes to the field of nursing and nursing information and technology. I'll let you go ahead and take it. And let's just remind our viewers that a few weeks ago, our guest here, Dr. Jonas Vu, was one of the honorees at our inaugural Excellence and Impact Awards in Phoenix, Arizona. Sarah, I would like you to take it over and introduce yourself to our viewers, who you are and what you do.
Thank you, Alpha. Thank you for this invitation. It's my pleasure to be here with you. As you rightly said, my name is Dr. Jonas Nguh. I am a registered nurse by training, but I work within, I am also public health, global health practitioner and scholar. So most of my work now is within the area of healthcare system strengthening in Sub-Saharan Africa or in low-income countries. I also currently serve as the president of the Maryland Public Health Association, where we address health equity to improve the health of all citizens in the state of Maryland.
That's a lot to unpack. So you're a registered nurse.
Yes, sir.
You go from being a registered nurse to being the president of the Maryland Public Health Association. What's the correlation between those two?
Yes, nursing is actually focusing on the clinical side. But within nursing, you have a subspecialty of public health, where this also, we look into healthcare that is non-clinical, where you look on systems or policies or a structure that you can address to the population to improve their health. So everything like environmental health, clean air, clean water, Medicare, Medicaid, those resources or structures where people can utilize to keep them healthy or address their health outcomes. That's a subspecialty of nursing, which is called public or population health. Public health in itself is a whole separate discipline and profession, and it has nothing to do with the healthcare, the nursing background. This is non-clinical. So both of them sort of intermarry, both of them align because they complement each other. You could do each one separately, but having that background, it gives you a complementary this thing where one supports the other. In fact, my academic background is actually in 3 different areas: nursing, healthcare administration, and public health. Nursing is the clinical side, taking care of patients at the bedside, and you can certainly go do an administrative route in nursing. But the healthcare administration, which is another field and a separate discipline, this is for people that want to become leaders in administrative or management roles in any healthcare environment. And then the public health angle looks at things like doing research, policy, looking at those big, broader things. So when you put all 3 of them, it forms like a triangle, and each one intersects with the other.
I was going to say that's the trifecta, right? So there's
Yes,
nursing,
definitely.
there's public health, there's
And
administration.
healthcare, yes.
That seems to be a lot to do, and you seem to have expertise across this broad spectrum of different areas. You are into research, you are into teaching, and you are into nurse. At this time in your career, how much of your time do you actually spend doing the nursing work?
I don't do that much anymore.
Okay.
And I haven't done that for a while, but I still work within that field. For one, I do teach, and I still do teach as my
You seem
role.
to enjoy that.
And yes, you have to keep in order to teach, you have to keep your licensure. You cannot, just like being a medical doctor, you cannot teach doctor unless you yourself are a medical doctor. So I still keep that. that my primary role is not so much with working in patients on bedside or in a healthcare environment. There's so many things, even in nursing or in healthcare. You can be a journalist. You can work on the policy side. You can work advocacy. You can work with research. All those other things that are still centered within that discipline, but looking at a different dimension. For
Wow.
example, we need policies that will close many of the gaps. You can focus policy. If you want to do research, you can focus research within that area. If you want to do teaching at the bedside, you can work with students. If you want to be an educator for patients, you can still do that. So there's a world of plethora of things that you could do within those disciplines. I just chose a different path or one of the paths within those disciplines.
So I am very interested about the policy aspect of everything. So I believe I love policy, which some people can define that as the social contract between elected officials and the people, right? That's the policy side of how society works. And I'm hearing advocacy. I'm hearing, you are helping with equity in providing services to people and population. And so to what extent does your role at the Maryland Public Health Association, like how involved are you with the policy side? Do you go lobbying at Congress? Do you go to City Hall? Do you take surveys in the community? Like, what's the daily life of president
Yes.
of a public health association? How does that go?
So in this particular role, I have a whole lot that I'm doing. There's not one
Okay.
typical day. I am essentially the CEO of the association, and I have board members or committee members that report to me, from communication to advocacy, or just like you have in the institution, you have your different department heads or managers report up to you. I oversee finance, recruitment, every other thing. One of the main things that we help do, which goes with our mission, is that we help advance healthcare of Marylanders. We engage in advocacy, we engage in legislation that push policies that would ensure that people have resources or close those equity gaps. So in fact, I love the fact that you just asked this. Next Thursday, I am actually giving oral testimony to the Maryland State Legislature.
Wow.
We're working on one of the big healthcare issues is the cost of prescription drugs. The
Yes.
cost us away, yes. Good example is insulin. A vial of insulin will cost you about roughly $350 in the US a month, while in Canada, that same vial would be $5. Imagine for people who are diabetic. Imagine for people who are pensioners, retirement,
Fixed
low
income.
income. How would you have to make choices? Do I pay my rent? Do I put food on the table, or do I get life-saving medication that I need? So in the state of Maryland and in many other states, they have this commission that looks at drug prices affordability. What are
Okay.
the costs? Because in the US, insurance companies and even with the government can negotiate how much you're going to pay for these drugs. It's a whole economy. Remember, we're living in a capitalist society.
Oh,
So
absolutely.
this cost, it is a whole lot for people. So if we here in the state, that is one of the big issues where equity, there's a big gap where if you don't have health insurance or if you don't have a good insurance, your out-of-pocket costs, you might be spending sometimes $30,000 a year for one of
Wow.
these medications. I am actually giving oral testimony with that commission. In my role, in fact, I'm actually serving a double role. My role as president of the association, but also as a patient. Because guess what? It just so happened that two of the medications that are under review are medications that I'm on. And then my mom is also on one of those. So it just goes to show that the work that we're doing, interestingly, now it is something that was actually going to impact my own life and my own welfare, just like many other people out there. And for many of us that are working adults, if you really don't have insurance, or even when you have the insurance, if the cost is 25% of your monthly income, how will you afford to live? Then we
That is
look for
interesting.
people, individuals that can testify, that can support to push those legislative agendas. So we begin to close many of those healthcare gaps.
That is interesting. I love the fact that you are able to volunteer and let our viewers around the world know that you take medications for certain disorders or illnesses. That is amazing because most of the times we don't want to put out our insecurities to the world. We want to appear as perfect.
That's
So
right.
I believe that vulnerability is the ultimate strength. When you're able to show the world that you have things that you struggle with or you're dealing with, then you can make other people speak up. And together, our voices are what make change. Because as the president of the Midland Healthcare Public Health Association, when I think it bolsters your credibility and it just shows people that this man really means business. Because not only is he representing other people, he is actually part of that issue that he's trying to resolve. So I love it.
Definitely. Thank you.
Oh, that's nice. Wow. This is amazing that you are so deep into this advocacy, population health, helping people. You talk about environmental, water, ability. So I'm hearing affordability and equity. Those things go hand in hand, correct?
Yeah,
For prescription drugs.
Yeah.
And something that I do know is, for example, when you are looking to buy a home or rent an apartment, there's this threshold of 30% of your income. So the apartment or home you're trying to rent or buy cannot be more than 30% of your income. And I'm hearing here that without your intervention at the legislature, drug prices may actually be going up to 30% of people's income. So you have to deal with finding affordable housing and paying for life-saving prescription costs.
So for those of us who are working adults, if it is a challenge or difficult for us, imagine how much more difficult it will be for somebody on a fixed income, somebody who is retired, somebody who is on a low income and is not even making enough. So that's where the challenge is, where it has to be affordable. Because one of the things we say is that medications don't work if people cannot take them. If you can't afford to buy it, it's not going to work. So what's the point of having it so skyrocketed that even the average person cannot afford to buy it? It misses the whole point of having that medication.
And it's funny because in my daily work, I happen to spend a lot of time working with people on fixed income, low income. We have patients or residents in our group homes, and sometimes they want to apply for food stamps, and they cannot qualify for Social Security benefits if they have food stamps, sometimes vice versa. And so these people are on fixed income, but sometimes you have to give up one to get the other. And I know people who work low-paying jobs, but sometimes they make too much money to qualify. And so you see that they will have to maybe drop out of work sometimes so that during the enrollment period they qualify.
And that's where the challenge is, where we have a system where, like someone said, and I'll paraphrase, you take one step forward, it brings you 3 steps back. So let's say the cutoff point for you to qualify is, and I give this just as an example, 15,000. If you make 15,500 just because you've passed that threshold mark, then it disqualifies you. So sometimes people are forced to stay at beneath that threshold just so they could qualify. But by them staying in there, then they continue to live in poverty. They continue to suffer all those negative effects because the way the system has been designed, it tries to keep you there and you remain there in order to get these things and just for you to have a marginal life. So that's the challenge, and that's why we're trying to address this.
Speaking of systems, you and I both agree that our healthcare system needs a major overhaul. And it so happens that we are in a campaign season. We are not making political statements here because we don't do politics on this podcast. We may involve in policy discussion because, like I said earlier, policy is that social contract between the people and the government on how to improve our lives. And I know I speak for both of us when I say this country, America, is still the greatest country on earth. There's not even a close second.
That's
It's
right.
the best country with the most opportunity, where the level, the playing field is the most level it could be on planet Earth. But still, there are things we can improve. I think we agree on that, right? We can improve. One of those things we can improve is our healthcare affordability and equity. We have to close that gap. Sir, let's talk about what is your number one gift as a person. I think I know, but what's your number one gift as a person?
I think it'll just be being my true self. I would like to say that one of the things that I love and I've been doing, I like to mentor others or many of my students. I feel that, like someone said, that to whom much has been given, much is expected. And for me, the knowledge and skills and competencies that I have, if I die tomorrow, what impact would I have made? What value would I have added? So rather than just keeping all of that in my head, which doesn't serve anybody, for those that I work with or interact with, I try to make a contribution to their own lives in whatever it is. And with me being primarily an educator and teaching, that's one of the ways where I give back to the students that I teach. And many of them have come back years and years later just to say thank you. So I know that's why I get my fulfillment. That's why I know that what I'm doing, it gives me that, there's that purpose and there's that
Okay.
joy in what I do.
Wow. So if I may summarize that, you just love to serve. That's what I'm hearing. Like
Yes.
you love to
Yes.
serve people, you love to help, you love to provide assistance to people, correct?
Yes, sir. I
And
think that's a good way to summarize it.
yeah. And I don't know if there's something that is connected with that and nursing, because nursing, at the essence of nursing, is helping humanity. It's helping people overcome difficulties or transition from periods where they are struggling to strength somehow. Those two connected. And when did you find out this ability of
Nursing,
loving
in
to
fact,
serve?
nursing is a service-oriented profession. That's in
Correct.
whatever capacity you're working. At the core of it is that you're serving. And you cannot go, it is one of what we call those helping professions. You can't go into it with the idea that I want to make money, I want to be a millionaire. Now there's lots of opportunities for you to be successful. The core and the core foundation of it is that you are serving, whether it's your patient at the bedside, the students that you teach, the community that you work with, the research that you do, everything is grounded to help make a difference, to help be of service. So nursing is one of those, just like with many other health professions. But I think from a very young age, I just knew, coming from Cameroon, Sub-Saharan Africa, where we have a lot of healthcare disparities and a lot of disenfranchisement in healthcare, as we all know. And even today, those things still do exist. From a very young age, I just knew that one day, and I said to myself, I think probably 5 or 6 years old, one of those, one day I was going to come back to make a difference. I was going to come back. I'll go to school. I knew this. I'll go to school until where I just had in my mind, until where school ended. I did not know what that meant. I just knew that I will go to school to where the end of school, as if there's a ladder or there's a top. And then I'll come back to make a difference. But I can also see how this developed in me from a young age, because my father, he owned his own business as a sole proprietor, where he would import baby goods. And then he used to take me to the hospital. We have this hospital in my town, Limbe, that we grew up. Bota Hospital, that was where all the maternity ward, where all the women in that town would give to birth. And he would take me with him, I think once or twice a week, going there to distribute milk, the powder milk, to newborn babies and visiting them. And he would do that religiously. And I used to get so upset that, why are we not eating this stuff at home? Why should we be? He's taking to go and give them all away. So even at that time, and I keep to wonder that how come I have since 7 siblings, how come I'm the one that he will always choose? So even at that time, I think that it was born in me, or it began to be developed in me without even me realizing it. Interestingly, my work several, about 30-something years later, most of my research is focused on infant and maternal health, which is the area that my father was passionate about. And guess what? 30-something years later, when I went back home after being out of the US for a while, I went back to that same hospital and my father used to come and visit. This time, not with these same packets of milk like my father used to do. I had envelopes of monetary gifts to every single new baby that I found in the hospital. So you see how God does
Became full
things.
circle.
This area that my father was, 30 years later, I came back to do the same similar thing. So I just thank God for that. So when I think about it now, that God had planted this seed long time ago, now we are just harvesting the fruits of what God had already divined.
Wow. So I love stories like that, which talk about the influence and the impact that our community has on us. Because what your father was doing was planting the seeds of community service and paying it forward. Because he was fortunate enough to have more than he needed, and he saw the need to go and help other people who were needy. And a lot of people that are doing big things in life, they come from backgrounds where they had influences in their lives. And what I'm hearing is that your own father was the most impactful person in your life who led you down this path that you are on today. And things came full circle. You went back to the same place where it all started and you took it a step up, which is amazing. That is really nice. I like it. There's a season to plant and a season to harvest. So I guess
Definitely.
back then it was the
Yes.
planting and now it's the
Planting.
harvesting.
Now,
And then,
yes, definitely. Yes.
wow, I love that. I love that paradigm. So let us shift gears a little bit here and talk about leadership. So you are obviously a leader because you are the president and CEO of this statewide advocacy body. What kind of leadership challenges do you face? First off, how did you get that role? You are a black male in a female dominated profession like nursing. And I'm sure there's not a shortage of very well accomplished female doctors and whatever. I know that it's tough to be a male nurse in administrative positions. How did you get that role? Did you have to campaign for it? Were you appointed by the legislature? Like, what was the process?
Yeah, so for this particular role with MDPHA, Maryland Public Health Association, was through elections. You are nominated, and then the membership gets to elect you. Our current membership is about 7,000. So for those that voted, I won the majority, which says a whole lot. And I'm very humbled and grateful.
Thousands? Wait a minute.
Yeah,
So your membership is about 7,000 members. And who are
And
that?
that's
Who are
the
these like nurses and doctors and
no,
social
public
workers?
health professionals. Anyone who is within public health field, who is a member of the association, but public health encompasses from epidemiology, biostatistics, nursing. There's so many disciplines that function within a public health role. So for those who are members, it's a membership-based association. On our books, we have about 7,000. So those who are eligible to vote. But that's the total average number of our members. And it's a statewide association. So we cater to everyone in the state. So that's why it keeps me very humble and appreciative of the work that you do. But talking about how I got to where I am, I think it's from years and years of climbing up the ladder. In my academic side, I've been probably in every single position in academia that I could think of, from program director, program chair, and I've been a dean. I've been everything besides provost or university president. I've
Which
been
I think
all
should
those.
be coming
I've
very
led,
soon.
we'll see, but I've led many programs and I've been in so many different capacities that it just builds up to bring you to where you are. Those years or those challenges that I faced have all added to build up my skills, my
True.
knowledge, and my capacity to network, to advocate, and all that. It is not just something where you wake up one morning in this role.
It's just a lot of work.
So I'm thankful for that.
Wow. That is amazing. 7,000 people
Mhm.
under
Yeah.
your leadership.
And we're not even the largest. We're probably we're one of the smaller ones, but we
Wow.
that's just the size of our membership.
Is there like a national group meeting
Yes.
conference that you guys do?
Yes, we're in Maryland. We are the state affiliate or the state chapter of the national one. Each state has theirs, which is called the American Public Health Association. That's the state, the national association. We are just the state, yes. And we have a conference actually coming up next week in Minnesota for a whole
Oh,
week. The conference usually has anywhere from about sometimes about 10,000 people for the whole week with over
oh my
200
goodness.
sessions. It's a big deal. And you have people that also come from overseas. So we're excited
Man.
about it. And there, as a state organization, we have our own state conference, which is 2 or 3 weeks following the national one. And I'm actually preparing for that right now. We're making plans for our state conference as we speak.
Oh man. I gotta say, your dad will be very proud of you. Think of coming full circle, building and planting those seeds in you for public service and creating impact in your community. All those years back in Cameroon, the young kid who was accompanying his dad to go distribute milk at the hospital has moved to this great nation of opportunity and is now the president and the CEO of the Maryland Association of Public Health. If that's not a story of inspiration, I don't know what is.
We thank God. One of the things
Yes,
that
of course. I
what
know, and that you are showing our people that, there's a power of possibilities, right? Because you just have to keep working. And if you love the things that you do, eventually you will get what you want. I believe it's Zig Ziglar, one of these great motivational people back in the 80s. He said, if you give enough people what they want, you get what you want. Along those lines, I'm paraphrasing that. If you give enough people what they want, so you put in so much work, and you are now getting the benefit of leading this organization.
I'll give you. I think there's another saying, and I'll paraphrase. It goes something like, "Don't look to be a success. Look to be of value." So if you focus on something where it's value, the success comes along with it. Regardless of whatever you're doing, whether it's cooking, being a tailor, or mechanic, if you give that value, you'll be successful in whatever it is that you do. And that's what I strive to do every single day.
I don't think you try. I think you're doing it. I think you're a very modest man. You're not trying. You're doing great.
Well,
So obviously, being a leader comes with a lot of modesty and always having this mindset of empowering people around you. Because without them, your leadership is going to be. I can see that in the way you operate. It's all about your people. Okay, so now let's talk about, in terms of your work at the Maryland Association of Public Health Professionals or practitioners. Do you have a 5-year term, 10 years, 3 years? Like, how does it go?
the terms are 2 years, and then you rotate off unless you want to go in again for an election. So I'm actually coming up to the end of my term this year, and I want to move on to do other things. I'm looking to do other things. So this has been a lovely opportunity. I love it. I'll still remain as immediate past president on the board, ex officio, and all that. And definitely, there's still opportunities to come back. But I'm focused on doing other projects that are much more expansion of my scope of influence, much more focused in the broader Sub-Saharan Africa. I think this gives me a very good platform, a very good launching pad. Now is the time where we're taking things to a whole nother level.
So this is a perfect segue into your future plans and projects. Anytime anybody mentions Africa, my eyes light up because that is my bias, right? I am an unapologetic globalist. I do believe in the power of connecting and bringing resources together. And I just love my African continent. I do everything. Every day I sleep, I dream, I think, I breathe how to impact Africa. That is what I do. That is who I am. And to remind our viewers around the world, this is the Excellence and Impact Podcast, where we engage world-class positive change makers like Dr. Jonas Vu here, who are creating an impact that goes way beyond their communities. We focus on the areas of healthcare, education, entrepreneurship, and leadership. And he is here today in his capacity as a transformative educator and a leader in the healthcare field. And he's talking about Sub-Saharan Africa, which is, again, that's my heartbeat. And for the last few years, I have been working very feverishly with major organizations in Arizona, Thunderbird Global Management, Arizona State, connecting with the Mandela Fellowship to push our initiatives across the African continent. And so, my dear friend, tell our viewers what you're doing. And obviously, always here to help in whichever way I can when it comes to Africa, because that's all we do.
Thank you for this opportunity. So what I have working on, which will be coming down the next couple of weeks to months, looking to set up an NGO that will help to address vaccine equity in Africa. As we all know, Africa has a lot of challenges with resources, with healthcare institutions. And one of the big gaps that still exists is that every year, probably about 12 point something million children in Africa, when we say children from newborns to about the childhood years, go without those recommended childhood vaccines. If you think about reaching remote areas, think about areas where the nearest healthcare facility might be miles and miles away, but there are populations there that cannot travel. Or even for those that work, they have a substantial and a minimal income to be able to afford all those vaccines. So we want to look as to how can we begin to close that gap to provide vaccines at no cost to the millions and millions of children on the basis that when you protect them at the younger age, they grow healthy as we all, then all those childhood diseases and complications and mortality, you help to reduce that. So that's what we're working on. We're still at the early stages of getting that set up, but that's the vision that we want to make it come to pass.
Wow, I love it. So what I'm hearing is preventative healthcare solutions and a network across the African continent to help with
There.
vaccination, which strengthens young children as they grow.
Yes.
And I remember when I was young, we all had these vaccines for. I still have the little thing on my
Yes, I
hand
remember
here.
that. Yes.
Yeah, for tuberculosis. It was one of the.
Yes, of those vaccines. Yes.
Those are life saving, and I would like for you to just inform our members and our viewers about the importance of vaccines because obviously there is some people use it to politicize their views and detract other people from the reality. Can you inform our people how important vaccines are and that they really save lives?
Yes, and thank you for bringing that up. There's a lot of misconception, misinformation, and false information out there. When you look at the research and you look at it for years and years that have been going on, vaccines are easily the number one thing you could do to prevent diseases. This is probably something that will not cost you as much. Think about it. Would you rather get a vaccine that will prevent you from getting sick or wait until you have a condition or disease? Then now trying to treat it, which will cost you, and you probably have a life-changing effect. Think of something like polio, where if you miss polio, now you're crippled for the rest of your life. That
Wow.
could easily have been prevented. And in many countries, like in the US, polio has been eradicated just through vaccination campaigns and programs. That is not so in many areas in Africa. But we're continuing to push because this is probably the most cost-effective way to prevent diseases. And even with adults, when you look at with the COVID and here in the US with the flu vaccines for many elderly population, you take it to prevent because when the flu season comes here, when I used to work in a clinical environment, many of the people that who die easily or die first are those who did not get the flu vaccine, especially for those that have comorbidities, even as an adult. For young
Hold on a
girls,
second.
there's HPV.
Hold on. Let me interrupt you. What are comorbidities? Can you inform our guests what comorbidities mean, please?
Yeah, so that means those that have many other underlying conditions. You might have diabetes, cardiovascular disease, and you're fine for the most part. But then you get around somebody that has a flu or you catch an infection because you already have that underlying condition. Your body now, your stress of your body is now elevated. Your body cannot cope. That's why during the COVID epidemic, most of the people that died were those that had comorbidities. If you have obesity, cardiovascular problems, asthma, you are compromised. For
Okay.
those who were relatively healthy, living a healthy lifestyle, had protected themselves, had good immune system, your body can withstand that. Your body can fight it off. So we want to, that's why we take vaccines to protect against something in the future so that even if I get into an elevator and somebody is coughing and sneezing, oh, my body already has that system to fight it off, a strong immune system to fight. And then you just walk away and don't even notice that you just bring something that somebody had coughed and body can kick it out. Somebody who did not have that immune system, 2-3 days they're laying in bed. Next day they are going back to the ICU just because they already had some underlying things. So whatever we can do to boost it's just like a defense mechanism. You're going to fight a war. You have that fortress. That's what vaccines do to us.
I love it. I love it. I really appreciate that public service announcement, especially with social media and a lot of disinformation, like you said earlier. And a lot of people are so gullible to people just take what they see. They don't have that filter.
Critical.
So I really appreciate that. And I hope our people will take that to heart. Okay. So I was looking at your bio on your profile, and it could take a few minutes just to go through the awards. You have had the most prestigious awards in the nursing field. I think it's the Florence Nightingale Award, the Daisy Award. You have had awards from the Maryland magazines, and I know you don't do the work because you want to get the recognition. I know you do the work because you love to do the work. I know you do it because You love to serve your community and make the world a better place. But how does it feel? Like at this time, is it numb when you keep getting awards? Are you just expecting them to have honorary doctorates from law
Doctorate,
school?
yes.
Where's that?
Yes.
In the UK?
No, that's an honored doctorate of law from my alma mater, the University of Dundee in Scotland, where I did my master's degree.
Oh my goodness.
Yes.
How does it make you feel like when you get this recognition, man?
Interestingly, tomorrow, the Black individuals who are DMPs, they have their association. Their conference is actually tomorrow. It's going on this week. They have the ceremony tomorrow in Philadelphia. And one of my students that I mentored had nominated me. I'm getting the mentorship award for that. But at this point, no, I think it is just, I stopped counting at 18. I have a cabinet in my house where all of them are there, and I appreciate it, but I stopped counting about 18 of them. But at this point, it's just...
I feel offended that you're not recording that podcast or the drop with all your trophies.
Nah, I don't. Well, I just put in a cabinet.
Guess what?
I think the best part for me... Go ahead.
That speaks to the person that you are. You are going out there to create... make a difference and an impact.
That's the best part of me. I give you one story just to illustrate this. I've taught across all levels in nursing field. And when I was teaching at the pre-licensure level, before you go take your board certification exam, and I still do teach the exam if somebody needs me, one-on-one basis. I've been doing that for so long. So several years ago, I wake up one morning, like on a Sunday morning, I get an early, those kind of phone calls that come 6 a.m. I'm like, who is this calling me so early in the morning? When I answered the phone, a lady shouted, "Oh, Dr. Ngo, I just passed my board." I'm like, who is this? And she's telling me that she just passed her board exam. She'd not even told her husband yet, but she just wanted to call me because I was the only one that never gave up on her. I'm like, who is this? Come to find out, this is somebody that I taught about 3-4 years ago. That, of course, I've taught so many students, I can't remember all of them. But it made an impact for her that she remembered me, and I was the first one that she called to tell, even before telling her husband. And I can't remember who this person is, but that's just how it goes to show that the work that you do, it gives me that fulfillment, realization that it is actually making an impact to the students that you serve. And that's the joy. So just like with this doctoral student who nominated me for this one tomorrow, I'm just doing what I do, my normal stuff that I do, but it meant so much that she wrote, and I saw the write-up that was submitted, that she's saying that I'm probably half older than him, but he took so much good care. That's what the student is saying. That she tried double my age. I mentored and encouraged her so much that she just couldn't do this thing without the help and support that I had provided to her. So for me, this is just fulfillment.
I love it.
Tell me that making an impact.
And that's the essence of life, right? Fulfillment.
Yes.
When you feel fulfillment, you feel contentment. When you, because like it brings joy to your heart, right? Because happiness sometimes is episodic. Happiness becomes joy is that state of contentment, which is what you get when you get recognized for the work you do.
Yeah.
And that's amazing. I love it. At my event, you were there as well, where I was presented with some certificate, which I mean, I loved it so much because you put in so much work in the background that people don't see. And so these things just come and say, you know what? We see you. We appreciate you. We recognize you. Keep going. And without it, you will still do what you're doing. But it's always validation, if you will.
The other thing too is that so many times, especially in this Western world, and when we look at it from where we come from, we define success by how much your bank account is.
Correct.
And that's the only metrics. And while I have nothing wrong with being successful, making as much money as you can, there's nothing wrong with that. But for me, money does not translate to happiness. You could have $10 million, you're still as miserable, you still have depression, you're still doing all suffering from the same thing that we all suffer. So until you find that passion, you find that one thing in you that gives that fulfillment, whether you have, Michelle Obama said, money really doesn't make you any happier. Money just reveals who you are. So if you are going to be miserable, you'll be miserable without it. If you're going to be happy, you'll still be happy without the money. So when
That
you
is true.
have that passion, you feel that thing that ignites inside of you, like another person that says that if it is your calling, it will keep on calling you. It will come back because you're doing it because it is in there in you.
True.
You're not doing
True.
it for external
Yeah.
yes. And that's why I do what I do. I've been a nurse for about 28 years now. For the majority of it, I only spent probably less than 2 or 3 years on the side. I transitioned into academia. I've been an educator. And that's why it is stressful, it's challenging because I love it. I have that passion for it. That's why I keep doing it.
Mm. So I saw on one of your profile photos or that you met Condoleezza Rice, the former
Yes.
Secretary
Yes.
of
US
State.
Secretary of State.
Yes. So you met her. And so where did you meet her? How did you meet her? Tell us that.
Alumni and also a faculty now at Warden University. And
Okay.
she served on the board of Warden, which so our paths have crossed in many
Oh,
occasions. But not only Condoleezza, that's one good example. But when I got my honorary doctorate in Scotland, the former Secretary General of NATO, the big NATO
yeah.
that we know,
Northern
was the
Atlantic
one.
Organization.
Yes, he was actually the chancellor of my alma mater and the one that presented me with him. And we had dinner, we interacted. I was so privileged that I get to meet people at levels.
Yeah.
That just goes to show that when you're successful and when you do those things, like it says in the Bible, the Psalm 27, that I'll prepare a feast before you in the presence of your enemies. You will
Mm,
sit and dine with kings. Those
that's
things will
correct.
come. I have had the opportunity to be with people that by no way do I even measure, would I even qualify to be in the same room with them. This is
Mm.
what just the work that I do has enabled me to be surrounded by people who
Wow,
are world leaders and have
that's
those
amazing.
kinds of conversations.
You are one leader yourself, so you are
Thank
right where
you.
you belong. And please don't take on the imposter syndrome. When you enter those rooms, it is because of the value that you
Well,
bring.
I am not the most qualified or the most brightest. I'm not. Even from school, I was never a top student. I was just a mediocre person, just moving on. But I think the one thing that I have for me is just that passion to keep
Okay,
pushing. Yes.
that's amazing. So, if money was not a problem, what would you do? Let us tell us what would you do if you had all the money in the world?
That's a hard one to know because there's so many challenges within a healthcare environment. But I think you just provide resources. I can pick one because every other area is equally as important. So I'll just go with my passion, which is for infant and maternal health. That's a program where you can, as many healthcare facilities that you can have for people to receive the care that they need. I think
Okay.
I'll just go with that because I see where, even from my own lived experience with family and loved ones, where people have had negative outcomes due to the lack of reproductive health care, due to the lack of resources during pregnancy and childbirth and things like that. And it really pains me because this is a disenfranchised population where they can't advocate for themselves. Here in the Western world, there's infrastructure, there's resources where you can reach out. Not saying that there's still not gaps, but it's
Yeah.
not as wide, as big as back home in Africa. So for me, I'll just go with something that I'm passionate about, which is infant and maternal health.
Good. Wow. So I always ask all my guests this one question, and you're gonna get it. So Bill Gates has this quote that most human beings overestimate what they can accomplish in 1 year and underestimate what they can accomplish in a decade. Are you the guy who has short-term goals or you think long-term, big horizon? Where do you fall on that spectrum? Do you do 1 year, 3 years, 10 years, or you do 20 years? Where do you fall on
Yeah.
that?
Wow. Thank you for that question. I appreciate that perspective of having that broad picture because it keeps that vision, and we should have that vision. But for me, and at this age, and with my lived experience of what I have gone through, I just focus on what I can do today. I
Okay.
focus on what I can do today and then take the next day. Because for one, tomorrow is not guaranteed to any of us. What can I do today? And then what can I build on that tomorrow? How can I build on it? if I set too lofty a goal, I might not achieve it. And if I look too far into the future, I might get overwhelmed or I might try to do so much. So for me, to make it manageable, to make it in a way that I can accomplish, I do one thing at a time, one thing at a time. Then that momentum builds. Then you have that track record where you can build and
Yes.
build. So I just focus on what I can do for today. I will have like an overall vision. Let's say I want to be an educator in dialysis care, or I want to improve care for dialysis patients. I said, okay, what can I do today to begin to realize that goal? One, let me see if I can find out information on the internet about dialysis care in Cameroon. That's two. Let me see if I can connect with people in Cameroon the next month. Just like that, one thing at a time, you begin to build. I love that incremental approach because you
Okay.
don't get too overwhelmed, you don't get too frazzled, and you can begin to build. You build your story, but the frames within that big picture. And then the other thing too is that when you start doing the work, it might change. Your goals
Correct.
might change. You might find out, oh my God, this is even a more pertinent or relevant era. Let me change. Or you hit a snag. You have to make that readjustment, strategic plan. What can I do? Or I just start on this. I get funding of $1,000. Wow, it just opens up. I can expand my vision. I can expand my
Okay.
mission.
I like it.
So I like just to focus on that one small thing at a time. It keeps me going.
So I love that perspective. And it is so true when you say your vision can expand or the plan
And
changes,
change.
because the goal is always the same, but the plan
Yes.
always changes.
Yeah, change.
Because
Yes.
it always changes. So I think that is where adaptability and flexibility come in.
Yes.
And for some people, like you said, what I picked up on is yourself. And it is very important to know ourselves and know our strengths and weaknesses, because some people, when they look too far in the future, it brings anxiety. But for some
Yes.
people, it is that overarching, big, ambitious goal that keeps motivating them. So what I'm hearing is that you have mastered the art of knowing thyself, and it is working perfectly fine. And
I'll
I
give
like
you
the
an
expansive vision because,
Yeah.
for example, in my case, when I launched the Excellence and Impact Foundation, I had a very skewed vision of it. And in the last 2 months alone, it has expanded. I am seeing a whole lot of a higher horizon because now things are getting clearer. And so I love your take on it.
And that's why,
Everybody has,
yeah, that's why when you get into the weeds of the things and you start into the doing, you're finding new
yes,
information. You have to be able to adapt. You have to be flexible in this day and age, especially in the healthcare or this environment that we work with. Things are dynamic. It is not a static environment. You might want to
correct.
start off in this way. You find that resources are more better utilized in here. Or, oh, this is something that I should have done before. You have to make those adjustments. You just have to make that. But going back to talking about that vision, I'll give you one example. I came to the US and I had to go, like many of us, challenges of documentation and all that. So when I was going back to school, I remember at that time I had all those challenges, but I was still going to school. And I would tell myself in the bus, taking the bus early in the morning, I'll be studying in the bus going to school. I'll say to myself, one day I'll be done. I just had that vision one day. I did not
One
know
day.
how. I did not know how it was going to happen. I only wanted to work when I first came to the US. When you go to the hotel, those bellboys that stand at the front
Yeah.
with those uniform and they take your luggages. There was one hotel down the road where I live. I love that uniform. I wanted to work at that hotel doing that. That is all I had for myself. I did not even have all these videos, but I just kept knowing that one day I will
One
come
day.
back when going to school. And it took whatever journey it took for me to be here. Where. So it goes back to just, I was focusing on what I could do every day and look at where I am now without it.
That is a testament of one day, the big dream. I love it. One day. Now that you are in where you are, I'm sure there's another one day. And I hear that this one day is in Sub-Saharan Africa. And
Yes.
our paths will definitely keep interconnecting because we are both looking at one day. The change we can bring, the impact we can create to provide opportunities to those in need. Let us talk about adversity. How do you deal with adversity and personal struggles? Do you have any examples of personal struggles in your life, how do you go about those?
I'm reminded of again, I'll paraphrase. There's a quote, and I can't remember exactly who said it, that God doesn't bless you richly until he has tested you deeply.
Oh,
I think that is so relevant to my life because
okay.
I was born with a congenital heart defect, which I've
Oh,
had to live with all my life. Out of all the pain, the struggle, the setbacks, and all that, it continues to amaze me that I am where I am. Not only just professionally, but even in my own personal life as I navigate my health challenges. From a very young age, it wasn't so prominent because I was younger. But as I grew up from my teenage years and all that, it came more pronounced. And I've had right now, it's 3 open heart surgeries. I've had that,
oh,
which as my
hold on a
life
second.
has had to,
Can you hold on a second? What?
yeah, my 3
Three
open heart surgeries,
heart surgeries.
and having to deal with this, with everything that I'm dealing with and everything that I've gone through at the same time. But this is the part that still gets me. When I had the first one was in Cameroon, when I was still probably a child, a team of doctors overseas came. My father could not afford to pay for that. So the charity paid for it. And this was way back, probably what, 20 something or 30 something years ago, way back. Think about the technology and the resources back then. When I came to the US, my second one, yeah, the first one in the US, guess what? When I requested time off from work, because I was working as a contractor, they declined that. So I lost that job just because I needed my health. Guess what happened when I went to the hospital? When you check in, you're doing all the admissions paperwork, and they're asking me, do you have any insurance? I said, I don't have a job. Thinking back at it now, that person that terminated my employment actually set me up. That same termination qualified me. I got my first surgery free of
Oh,
charge. I did not pay anything. Yes.
wow.
Yep. That was the first one. Then the next one, the third one, and again, this is another example. I was teaching at a local college about 15, 20 minutes from my home. We went in there, supposed at that college at that time, you get paid at the end of the semester. So this was around Christmas time. I'm waiting that, okay, my money is going to come through. I'll use that money for my Christmas shopping. Lo and behold, pay period comes, there's no money. When I called them to say, hey, what's going on? They said they looked through it. They said, oh, I probably made an error or something on timesheet. So now they are getting ready to go for Christmas break. When school resumes in the spring, then they'll pay me back. Okay, this is when now my next surgery was coming up. Guess what happened? That money that I wanted to use for Christmas to do all your Christmas shopping, it just so happened that when I had that surgery, this next one, and I had to be home for all those time, that money that I wanted just to do my shopping, it came now to save me. And I tell you this, you think about this. Imagine that you have your monthly bills, your gas bills,
Yes.
electric, food, all those things. You add it up each month. Your monthly expenditure is like $2,000. That money that I wanted to go spend that previous month, right? It came at the exact amount. And I honestly, I tell you, like the exact amount that it was able to take care of me for 3 months. 3 months that I did not even have to work. I just stayed
Wow.
home. So that problem that I had there, God had already anticipated it.
Wow.
It came at the right time
At
after
the
I had
moment of
come
need.
back from home when I needed it so I can stay home and rest. So when I look at my story and my journey that all have been through, I see that God already had the answer even before the problem happened. So for
Right.
me now, even when I go through all this, like when COVID started, I had a contract job in Texas. I fell sick. I had pneumonia. This was at the beginning of COVID. I had pneumonia. Everybody thinking that was COVID, but it was not. It ended up being pneumonia. The job terminated me. They terminated me. I stayed home for 6 months, no work, because I have gone through all of these things. And I look at it now that what more could be there that I've already been through the fire? What more could I not be standing now? So for me, it
Wow.
just makes me know that God already has in control. Even when I had my first heart attack here in the US, I was home all by myself. I was actually going through it, knowing that something was happening. And think about this, even with my healthcare and nursing background, it did not click in me that I was having I just knew that something was wrong. I took my bag, got dressed. I had a class to teach that day. Got dressed, got into my car, drove through the highway, went to a campus, parked my car in the parking, walked across campus, came to class. This was in January, middle of winter, snow had fallen. All this while, having that heart attack, all those things going on. I could have had
Oh,
an accident on the highway. I could have killed somebody or myself. Nothing happened. Walked across campus, came now into the building. There's a corridor, a hallway, then classes on the side. So before I got into my class, you had these benches on the side. I said, let me just sit on this bench and just rest before I enter my class. As I sat on that bench, I just collapsed. It was the same students that I was coming to teach that called 911 and they rushed me to hospital. By the time I woke up, I ended up I'm in the emergency room. Guess what? The doctor that treated me in the emergency room, he ended up being my cardiologist years later on. He told me this several years later. On that day when he saw me in the emergency room, he just knew that this one was gone. He did not even want to do anything to me. He knew that he would come back to work the next day, they'll tell him that patient had died. My heart, the ability for the heart to pump blood is calculated, it's called ejection fraction. It's calculated out of 100%. The average adult, their heart functions 65%, which is the normal. My heart was not even beating up to 15%. My heart was not. Yes. And I was working, doing all these things, not even knowing what I was going through. God enabled me to come to where I had my students there. They called 911, sent me to the hospital. This is how. So when I sit here with all that I've gone through, I said, the
wow.
day that I'll die, I'll ask God that, what did you see for me? What did you see? Who am I? What did you tell me? Because I don't even
Wow.
don't see the
Wow.
thing.
Okay, wait a minute. So you were having an active heart attack. That's what you said. You
Yeah.
left your house, you got in your car, you drove
Yeah.
across the
All of
freeway,
those. Yeah.
went to campus. My
Walk,
good,
pack
what?
my walked across. All of those. It baffles me. I cannot. It's like
Wow.
something that I'm reading. Then I've
Wow.
been here with the two now. I've not paid a dime. And I say this with all humility and with all thankfulness. I've not paid a dime for my
Wow.
two open heart surgery. This last one that I had, I stayed home because this last one was an aortic aneurysm. I had like a bulge on the aorta. The aorta is a big vein, the largest vein that supplies blood. If it bursts, there's no sign or symptom. If it bursts, just like a pipe that ruptures, it just
Yeah.
ruptures and you die spontaneously. I had that bulge there for about 7 months. How was it discovered? I went to the hospital doing my routine checks. I had my previous cardiologist had retired. I got transferred to a new doctor. He sent me just to go do some routine follow up. I kept putting this up. For 7 months, I kept just putting it up. This doctor too will not leave me alone. This man kept calling. So after all these months, I only went back just to do it so that this man would just get off my back. That's why
Wow.
in checking the heart valves, because that's what I had replacement artificial heart valves. Since I've had the natural ones replaced, they discovered this aneurysm just like a bulge. That imagine you have a bulge and then they take a needle and just pierce on it. It just bursts and all your blood and you die spontaneously. That's how it was discovered. So this is something that had just been there, but increasing without me even knowing. I could be here right now with one. I don't even know. But that all this time, God just made it that this man would, and that's why when I think about these things, it could have gone the other way, but it did
Yeah.
not. You just see the hand of God. There's nothing
Wow.
else you see the hand of God in my life. So all these other things, it don't bother me because if God had wanted to call me, he had more than enough incident that he would have called me back. And
Wow.
just gives me that peace that what God, I put it in your hands. When it's
Hmm.
my own time, when your work has been done, when you have completed what you want to do in my life,
Wow.
then you call me back to come down my work. So now I don't even bother about stuff. I don't bother about them. I used to have in my younger years, oh, I want to have this, oh, I want to have that. I have been to situations where even being in the ICU several times, being on the ventilator, that which is so painful. I've been there, being alive, but suffering pain. And I say that no amount of money in this world would even give you
Yes.
one breath of air because I've
True.
been there. So why should I be killing myself to accumulate material things? For me now, the joy and pleasure that I get is spending time with friends, family, loved ones, doing things that enrich, things that make an impact, things that contribute. And I just think that, I think for me, this is only my opinion. That is why God is continuing to find favor with me, because I have that. And just like my father did, and amongst all my other siblings, I wonder how come I'm the only one that is doing some service oriented, that has this part. Why am I the only one? God
You
must
are the
have
chosen one.
something. Yeah, God must have had it. I'm the
Yeah.
only one. I do this, whether it's teaching. Before I got sick, I used to work internationally, where I traveled. I've been to probably 21 different African countries, which I love going there. But that
Wow.
is where my heart is. And that's where this new project that I'm taking on is born out of it. Because in Africa, we have so many challenges, as you very well
Yes.
know. But for me, I see it as an opportunity that we can come in and begin to address. Here in the
Absolutely.
US, many things available. I want to make a contribution where it could be right, it could also be felt. And one of the things that I did, and this is just specific with research, one of the research projects that is published, I won 2 awards from the American
Oh,
Public Health
of
Association
course.
and the National League in Nursing. I
Of course.
designed a model for maternal homes in Sub-Saharan Africa that has now been replicated in about 5 different countries. The data from this project indicates that, I think as of date, about 2.5 million women have accessed services from these homes. Many of these women will never ever encounter me, never ever meet me, or not even know even 1/10 of them. But the work that we do is making a big difference for somewhere
I
else.
like
So
it.
I
I
think
like
God
it.
has a reason, a purpose for me still to be here. And when it's my
Wow.
time, I'll go home, I'll go and say, thank you for using me.
Wow. So that has been a rendition of maybe you were in church for your faith. I love it when people wear their faith on their sleeves. It just tells me the kind of person you are, right? Because without your faith, I don't think you'll be where you are. And what is faith? Some people say it is the ability to see the invisible,
Mhm.
right?
Mhm.
Because we can either choose faith or fear. And both of those
Right.
things, faith and fear, are all predicated on what we cannot see.
Yes.
We have faith in
Mhm.
what we don't see. We fear what we don't see or don't know. And I think you have made a very conscious and wise choice to have faith, not fear. And I
Yes.
think that it has brought you this far. And you definitely are just getting started. I like the fact that you have spent all this time in this country, in this great country, helping and providing support and services to others. And you are now about to take it to the place of need, the sub-Saharan African continent, which is our
Yes.
home. And my dear friend, I'm very proud of you. I'm happy for where you're going.
Thank you.
And
Thank you so
I'm here to help in whatever way, that noble mission of yours to provide accessible,
Thank you.
equitable, affordable care to those children in Africa through vaccinations and, I guess, strengthening moms and young children grow into more productive members of society. So, do you have any closing thoughts here? This has been a very exciting one. And anything you want to tell our viewers where they can find you? Are you on social media?
The only social media I'm on is on LinkedIn, where if you just type my name, Jonas Nguh, you will find me on there. I'm also on Twitter. So those
Okay.
are the two that I'm on right now. But I just want to thank you for this opportunity to speak with you and to share my own journey, my own lived experience. And I'm hoping that, my hope is that even if it makes an impact, or as we say, it makes an impact with one person, I would have succeeded. I think, like I said earlier, to those that much have been given, much is
Much
required.
respect.
And
Absolutely.
I see my own purpose as making a contribution. At the end of the day, if we look at many of the world celebrities and people that have come and gone, you're not going to take the money. You're not going to
No.
take the $1 million homes. You're not going to
No.
take the cars and all those things. I think our lives have to have meaning beyond our passing. And
True.
our lives have to make a contribution to society. And that is one thing that, like I always say, it's a passage in the Bible. I can't remember which one. It says, Lord, make me an instrument of your glory. My hope is that my life could be a demonstration of God's goodness when you look at my health, and also his greatness, that even in the midst of all the pain, the suffering, the challenges, God's greatness still comes out. If I can be that demonstration, then I think my work here is done. So thank you again so much for this
Wow.
opportunity.
Let's just add Reverend Nguh to your name, because I love how you keep talking about and demonstrating your faith in God and your belief and your purpose, and how God is using you as a vessel to bless the world. I love it. Keep that faith, because we will need it. Thank you very
Thank
much.
you. Thank you.
So, gentlemen, thank you very much for joining us on this very engaging episode of the Excellence and Impact Foundation. We are connecting communities and we are inspiring the African dream. And our guest here, Dr. Jonas Nguh, is one of those people who is going to be helping us take this message of hope to turn those obstacles in Africa into opportunities, those stumbling blocks into stepping stones. Thank you very much. And please like us on Facebook, follow us on Instagram and on Facebook, and we'll see you next time. Thank you.
Thank you.